welcome to ESC TV. I am Jean-Philippe Collet from PTA University Hospital, and it is my pleasure to welcome Steen Dalby Kristensen from Aarhus University, Denmark, who coordinates Village 4, CAD, Ischemia, resuscitation. Welcome, Steen.
Thank you very much, Jean-Philippe.
So, what happened in your village this year? Can you give us some highlights?
Yes, of course, many things. I think one of the things that was discussed a lot was the pre-hospital management of ST elevation myocardial infarction patients. And with a new trial coming out at this meeting, the Atlantic trial, I think it sort of re-emphasizes that although the trial's primary endpoint was negative, there was actually reduction in stent thrombosis. So I think to implement early therapy in STEMI patients in the network is one of the issues that was discussed a lot. Another thing was actually the multi-vessel strategy for primary PCI. If we have a patient with STEMI and we fix the culprit lesion, what should we do about the rest if there are several stenosis? And I think now we have evidence that we should also handle this stenosis. In the trial that was presented here, the culprit, this was done sort of immediately. I still think it remains to be established whether we can wait a little bit. And if I should mention a third thing that was presented this year, it's the non-cardiac surgery guidelines.
So, what is the most important message from these guidelines, which should be very practical, right?
Yeah, I think the most important message is that if we are in trouble, if it's really difficult, we should discuss together into a multidisciplinary team with both anesthesiologists, surgeons and cardiologists how we best handle the patient. I think also another thing that is important is that we have used this stepwise approach for assessing how we best manage the patients. I think this is a very logical way of thinking, and I think also it avoids using unnecessary diagnostic tests in these patients.
So extended heart team discussion.
Yeah, I think you could call it that. I mean, we can have several scenarios where we really need to be specialists from different areas that can discuss how we best handle the patient.
So I'm going to be the next CPC Village 4 coordinator. So what's going to happen next year? Can you give us some insights?
Yeah, I think that one of the key things that you're going to present next year is the new ESC non-STEMI guidelines. And I guess it's a field that we both love, and there's a lot of evolving studies. So I'm sure that there will be a lot of fruitful discussion also next year in London. And with you as boss, I mean, it can only be a success.
So you should attend next year ESC 2015 meeting in London. Thank you very much for being with us, Steen, and I hope you had a good stay in Barcelona.
Thank you very much, Jean-Philippe.
Bye-bye.
Bye-bye.